Thank you so much, Majid, for that excellent presentation and overview, and I commend all of you for the progress you've made. I would like to invite Nazeeh to make some comments and provide some information. I know we will lose you to travel shortly, so please welcome to the presentation.
Yes, Elliot, thank you for the introduction, and I would like to thank IFMBE and the SSBE as well for arranging this seminar, and I hope that there will be a continuation for this series so that we can build a knowledge base and localize it in the area of digital health. The thing is, digital health is becoming so involved in all aspects of health. I mean, 15, 20 years ago, biomedical engineers have graduated without they didn't need that big emphasis on understanding IT and information technology and these things maybe 25, 30 years ago. But currently, all medical devices are now connected to hospital networks. They feed from the hospital information system. They feed to hospital information system. Now there are technologies that are coming in like telemedicine and remote, for example, diagnosis, remote clinics that are operated from a central place where physicians can diagnose patients who are in rural areas or areas that are difficult to reach. Electronic health records are coming in. Internet of Things are helping physicians to make more smarter and faster decisions. Point of care systems are now being introduced near the patients and they are all connected to through a network to receive information and give information about the patient and their results. So technology, especially digital health technology, is becoming very adverse, and no biomedical or clinical engineer can afford to remain uneducated or unlearned about these things. You need to know programming. You need to understand what HL7 is, what DICOM images are, what PACS system is, how can you deal with storing images, retrieving images, network problems, data streaming. All these things are purely IT issues that are becoming very crucial for biomedical engineers to get involved to. So this link between IT specialists, health informatics, programmers, and biomedical engineers and health practitioners is becoming very critical to achieve an environment that can elevate pain, provide a good experience for patients so that they have a nice journey from the moment they enter the hospital until they get treated and get the results and all these things. So I'm hoping that this series will help in building a good knowledge base for clinical engineers on ground on how to tackle practical issues about interoperability, connecting ports together, connecting systems together, so that they can talk with each other smoothly without any problems. Now, when humans interact with each other from 3 or 4 different departments, I think all of us have faced this challenge. And if a process goes through 5, 6 different departments, then dialogue and communication between these 5, 6 departments is a challenge. It's not easy. Not everyone understands the language of the other. Finance speaks a language that is different from health practitioners, that is different from management, that is different from clinical engineers on ground. However, they all must meet together and communicate together to reach a final decision. The same thing happens with hospitals and technology within hospitals. Many hospitals, Ministry of Health is still facing a challenge in adopting one hospital information system. It's not there. Many attempts have been there since I was born, maybe. They are trying to implement a universal hospital information system. So far, there are many attempts. It works sometimes it doesn't. It works in certain regions while it doesn't work in others. And when you see private hospitals, they have exceeded far and have very, very advanced solutions. Private hospitals, military hospital, National Guard, specialist hospital. They all are working with hospital information system smoothly, while Ministry of Health, the largest health provider, is still struggling with HIS. Now, if HIS comes in, the next step will be integrating all these machines and devices to HIS, which is going to be another challenge. Still, most of biomedical engineering departments in the kingdom still do not have asset management programs. We do not have health technology management systems, health technology assessment programs. And in order to have health technology assessment, you have, one of the foundation is that you use technology to gather information about devices, and from that information you deduct ratings for the devices, their safety, their performance, their how their the service providers, the importer, the distributor, all of these guys need to be rated, need to be evaluated through electronic systems. Once HIS is there, hopefully, at least if HIS is not there, I hope that biomedical engineers would work together to at least adopt an asset management system within their hospitals. It's very unfortunate that you have big hospitals that still don't have a list of devices that they have within. They have an Excel sheet, and they claim that this Excel sheet has the list of equipment within that Excel sheet. If you go and verify these equipment one by one, I'm sure that a good percentage of them will be misplaced, inaccurate. You don't know where the device is, because these. So when you don't have electronic systems that help you in managing your tasks and your responsibilities, it become more and more difficult. Technology is there to make life easy for us. However, technology can make life difficult as well, because if we do not utilize it in the best possible way, where we communicate with each other, that's why interoperability becomes important. That's why having unified standards in communication, in systems, in at least the codes that we use, the languages that we use, how we enter data, how we manipulate data. If we don't have those standards, there is no point in technology. Technology will become, after using it for 2 or 3 years, you will have to remove everything and start all over again. This is what's happening with MOH. They keep using these HIS from here and there, and after 2 or 3 years, they remove what they have used and they come up with something new. And then after 2 or 3 years, they remove everything. Sorry, Dr. Balkhair, I have to be, I have to tease you so that you give us the best that you can. Yani. Every 2 or 3 years, they bring 5, 6 systems and they use a pilot somewhere, and then they remove it and they start all over again because it wasn't adopted with clear. I don't know. I can't judge why, but the continuation of this cycle is surely not in the best interest of the health system. The kingdom is very big. It's very huge, and we have rural areas, and digital health can help us in reaching the areas where it would be hard to find specialists and very qualified people to be there. And we look forward for good technological solutions that improve the healthcare. I really wish I could continue and remain with the session, very interesting session, but unfortunately an urgent thing came up and I had to travel. So I thank you again for the opportunity to share my small views, and I hope that the audience would benefit from the presentations that will be coming forward. Thank you very much.
Thank you. We very much appreciate you sharing your wisdom and perspectives, and we will talk more about these topics. And we wish you safe travels today, and we'll rejoin these discussions very, very soon. Thank you.